when we talk about being metabolically dysfunctional, we look at 5 parameters. We look at your triglyceride, we look at obesity, we look at your waist ratio, we look at insulin resistance. Yeah. So when we're looking at these kind of things, we see insulin resistance, obesity in almost all of them. And this comes from chronic inflammation. And chronic inflammation comes from bad lifestyle. Now, when we talk lifestyle, we don't talk just food. We talk diet, it's sleep, it's gut health, it's stress, it's the supplements you take, the exercise or the lack of it. So when you look at all of this, and people who are typically don't exercise or have high stress or bad lifestyle, bad eating patterns, they develop chronic inflammation. And chronic inflammation then leads to you being metabolically dysfunctional with any of the 3 of the 5 criteria. And when that happens...
Oh, so there's a thing. Any of these 3
of the 5.
Of the 5.
And what happens is, this is what we call metabolic syndrome. And when you have metabolic syndrome, by the way, 12% of Americans are metabolically healthy. Do the math.
Wow.
12%. Yeah. So that's a huge number of people who are metabolically dysfunctional.
Correct.
Yeah. In India, we don't have the exact numbers, but it's more or less the same. Now, what that means is, in some patients, it will translate as just being overweight. In some patients, if you have the gene, of course, it will make it easier for you to get diabetes. But is that your fate? Hell not. In women, earlier, it can manifest as PCOS. So it depends on what part of your body is affected by that inflammation. You will develop different manifestations, what we call these lifestyle diseases. So in somebody, if it's a heart condition, will get dyslipidemias. So it depends on what. Somebody who's just eating bad and too much carb will go and sit in your fatty liver and cause visceral fat and fatty liver. So it manifests differently. But honestly, if all of them more or less require the same kind of lifestyle intervention.
These 5 parameters that you spoke about, right?
Yeah, but the ways to reduce these or to correct these 5 parameters, the method of doing it is almost the same. Then, of course, you have specifics. If somebody has a fatty liver, you'll give a different supplement, for it, or different medication for it. If somebody has diabetes, obviously you'll do something else. If somebody who's got PCOS with, say, who's being infertile, or, so there are medications, sometimes in my case, more often than not medication, but there's certain supplements. So those change. But I would say in 80% of the people, you just follow the certain way of lifestyle. And you will see all these medical parameters, the metabolic parameters, hugely change for the better.
That's fascinating. If you can get down to the root cause, you can pull it out from its, from the roots and hence have a healthier life. What are the elements that you focus first on? Is there like a set steps that you follow to get people to lower their inflammation, to get out of this metabolic condition? Like how should somebody start off or start thinking about this?
Yeah, absolutely. So I do a diet recall, of course, and I do an entire detailed medical history, the drugs that people are on, because very often drugs cause a lot of side effects. And patients come to me with those side effects as, oh my God, my cholesterol's elevated or my sugar is elevated now, when they're taking statins. Withdraw the statin, your sugar will come down. And I'm saying this because this happened to me last evening with a patient. But, and they were like, what? I'm going to have a heart issue. And I'm like, nothing's going to happen to you. Just take it off. Or, we've got so much muscle ache and pain or myalgias.
Correct.
So, of course, you do a detailed history and you do a family history. You do a genetic profiling. You make them do their blood work. And then you sit and tell them, these are the lifestyle changes starting from diet. Right? So, if I can go into details, the first thing in the diet I would tell everyone across the board is just to stop sugar.
Love it. Okay, so first habit to talk about when it comes to nutrition, stop sugar.
Stop sugar. Stop all refined food. Anything that comes out of a tin, can, bottle, package has a long shelf life. It doesn't, it's going to reduce your life.
It's going to reduce your shelf life. Okay, so getting rid of sugars, getting rid of these processed foods.
Yes.
Now, fine. If instead of processed foods, what do I start eating? Because like you enter somebody's home, the kitchen is full of processed food. Like you take it out and replace it with what? Like what does your kitchen look like?
Okay. Before we get into that, I'd like to say, people tell me, they call me the anti-sugar evangelist apparently in all the interviews, which is fine by me.
Then you're on the right podcast because same.
Yeah. And I hope that everyone else listening to this also becomes an anti-sugar evangelist after listening to this. But we need to understand why sugar is bad for us. Because people say, oh, but it tastes so good. And oh, it's, barring that momentary satisfaction, that instant gratification, sugar offers you absolutely nothing else, right? So it reduces your immunity. It causes inflammation in every part of your body, head to toe. And that is something that needs to be drilled home just for that instant gratification, for the 2 minutes of sitting in front of Netflix and, having that cake or having the bag of chips. And, it's not just sugar. All processed food, it could be savory, converts into sugar in your body.
Correct.
So people say, oh, but I didn't have sugar. I had a bag of chips. Hello, the bag of chips is sugar in your body and it's going to convert into fatty liver.
Sugar converts into fatty liver. You have to explain this part because fat is what people think of as fat. There's no fat in sugar.
Yes. So that is such a sad misnomer. And I'm so glad you asked that. But, it's not the fat that causes the buildup in the, blood vessels of the heart and causes heart attacks. It's not fat that causes fatty liver. The bad fat, sure, will cause it. But if you have good fat, it's going to protect you. It's not going to cause any of these blockages in any part of your body. But the sugar that you eat, the processed food that you eat, goes and converts. Because look, what happens when you eat sugar in your body? It has to go somewhere and do something. So either it's expended, which means you're constantly exercising, running, doing something, which none of us really do. I mean, we'd be spending 8 hours a day at the gym. Or it has to go somewhere. So where does it go? It goes and converts into fat, which sits around the viscera, which means it sits around the liver, the deeper organs. And then that gets converted into triglycerides. Triglycerides are nothing but fat globules. So when you do a cholesterol check, when you do a lipid check and you see your triglycerides are high, your doc will tell you, oh my God, your fat is high. Stop eating fat. And I have every second girl or patient who walks into my clinic saying, I'm on a low-fat diet. I'm still not dropping weight. I'm on a low-fat diet. My blood pressure is still high. Or, men in their 40s and 50s will come and say, I don't eat fat. Why do I have blockages in my heart? I'm like, quit the sugar. Eat the fat. Make the fat your friend. Make the good fat your friend. It's that sugar that's converting into your triglyceride. And the triglyceride is going and causing the blockages in the heart. It's causing your fatty liver. It's causing you to be insulin resistant. That is the problem. So fats are vilified and so sad that they're vilified. So eat the good fat.
So I love this sentence that says, don't blame the butter for what the bread did to you.
Oh, so well said.
Nah? Isn't it so
well
brilliant?
said. Brilliant.
Like, you told me not to have bread and butter. No, I said not to have the bread, have the butter.
Yeah. So the fat, let me just put a caveat there though. The fat that you need to eat, of course, is grass-fed if you're eating meats, and it has to be organic and good quality fat, not the bad ones, which are typically the seed oils. So, sunflower, safflower, canola, rice bran, those are the worst kind of fats. Those will be a problem for you and those can cause fatty liver.
Those also cause inflammation.
Of course, because they cause inflammation, they cause the fatty liver and the inflammation in the heart, which then, causes blockages. But not the good fats, not the avocados and nuts and seeds and olives. And
Make a list.
Avocado. I'm going in, I think, in my favorite order. So avocados, nuts, seeds, olive oil, extra virgin especially.
Do not buy pomace. Pomace is used to make soaps. If you find pomace oil on your olive oil bottle, please throw it away or use it as a massage oil, but that's it.
Okay. So you can use the Evo oil and avocado oil. Ghee is great for you, as is some amount of coconut oil. Just make sure these are not refined fats, even the ghee and coconut oil. They are good quality and grass-fed.
Grass-fed coconut oil.
No, grass-fed ghee.
Okay. But why coconut oil in moderation? What is the...
So, I do find for some reason that, of course, it's a saturated fat and we don't have a problem with it. But the thing is that I do see sometimes lipoprotein small a go up with coconut oil. And I haven't, done a proper research over like a randomized control blind study in X number of patients to say that there is definitely no connect. And I'm also a very conservative doctor. And I say that if I don't know for sure,
don't want to prescribe it.
Do it in caution. I'm going to put out the caution there.
Fair. So get your sugar out. I have to tell you a funny story about the sugar.
Yeah.
So as you know, very anti-sugar. So one day I said that at home, why should we have sugar? If we don't have it, why are we giving it to our guests? So why should we poison them? So we banned sugar from our, and our house help then had one small hartal. They went on strike. They said, why are you taking away the sugar from our chai? And it was just like, all right, you couldn't get away from that one. But yeah, so, there is so much of sugar that is ingrained in our system, right?
My patients have stopped giving me sugar. They've learned the hard way. I'd get like laduri when laduri was not in India and came straight from Paris. And I would distribute it to my staff in front of everybody and their heart would break. So they have learned the hard way.
So sugar out. Then the other thing from your pantry, like you said, the seed oils out. What else?
All the refined food, everything that comes out of a tin, can, bottle, packet stuff, like I said. So it could be, the pastas, the ketchups, biscuits, all the patisserie products, those go. That doesn't mean you never have them. That doesn't mean we're not going to take all the fun away from your life if that's what you consider fun. But so it doesn't mean that you can never have them. But it depends on how much. So, to put things in perspective, your liver can assimilate about 50 grams of fructose in one go, which is your simplest form of sugar. So, all your liquid sugars, maple syrup, honey, agave, which people consider so great, fruit juices, they're the worst for you. Of course, honey has its benefits, but I can give you 10 other foods which don't have the ill effects of sugar and have the benefits of honey.
Correct.
So, if you really must have good quality Manuka honey, organic honey for XYZ that works for you, go ahead and do it. But then balance your sugar intake or your refined carb intake in the rest of the day. Why? Because your liver can't assimilate more than 50 grams of fructose a day. Then the extra sugar will go and convert into your fatty liver and deposits on all parts of your body, in your blood vessels. So one needs to keep that in mind. So it's not everything is out of reach, or you can never have a croissant, you can never have a pastry. It just means, okay, I really devour that pastry somewhere and I'm going to eat it, but I'm going to make sure I'm going to reduce my carb consumption in the rest of the day. And then I'm okay.
Then you're fine.
Then you're fine. Of course you're fine.
Doc, explain the difference between the glucose and the fructose, because everyone says fructose is good for you, not in like it's good for you. Right. So how do you...
fructose is by far the worst.
Correct.
See, we need to understand that glucose, which comes in all your refined products, right, it's utilized by every single cell of the body. Fructose is metabolized only by the liver. So there is a huge difference. So like I said, the fructose that you take can be assimilated only that 50 grams at a time. After that, it cripples your immune system. So even if you are going to have more than 50 grams of fructose in one go, I tell everyone the least you can do is not touch another carb for 6 to 8 hours.
Wow. Correct.
Because for the next 6 to 8 hours, it's crippling your specifically NK cells, which are your first line of defense cells. So, you don't want that to happen. So if you must, and you're what you call a carb fiend and take great pride in saying that, at least for the next 6 hours, do yourself a favor and don't eat anything carb driven, to drive that insulin spike and the leptin spike and all of that. So glucose, fructose, both bad for you. You need to understand that ultimately all convert and all have the same ill effects. But if you're going to have them judiciously, balance it through the day.
Correct. While you were talking, I remembered, we normally end up feeding our children all the sugar because ये लोग ले सकते हैं. मैं कैसे child है, बच्चा है, मतलब उनको कुछ नहीं होता है. And as a result, there's a huge increase in children's fatty liver disease, correct?
Absolutely. And PCOS, my God.
And PCOS.
I see kids, our parents come and typically the mother will come with the kid saying, school's over, virtual school, only a couple of hours. And very often I'm treating the mother, but my attention's on the child. And because I'm thinking this child is a sitting time bomb. She's going to have diabetes growing up. She currently has, because I can see the nape of the neck has what we call acanthosis, which is deepened, blackened pigmentation. I can see it in that child already. I can see that little pot belly. And I'm like, you're giving that child, while you're sitting in my clinic waiting for me, the child is having like liquid sugar, is having fruit juice.
Correct.
Or be quiet at the doctor's clinic and I will give you chocolate and I'll give you ice cream if you're good. I'm like, holy God, don't do that.
Bribe them with celery sticks, right?
Yeah, well, we don't have to go to extremes in life. But the thing is, why do children have that addiction for sugar? Because from the time you are small, the parent has created the habit of either creating a reward system or a punishment system with sugar. So now there is an affiliation. And everything in our life is actually affiliation. You think about it.
Correct.
You want your mother's food. You want, it's a source of comfort. But then you're teaching the child, because the child doesn't know better. You're teaching the child that if you're going to be good, sugar is a reward for me.
Correct.
If I'm going to be bad, sugar being taken away, that means sugar is a prized possession. So you need to rethink these things as a parent, because you're setting the template for the child's life.
Yeah, absolutely. And like you said, right, if you're bad, I will take away your chocolate. No chocolate for you when you come home today.
That's correct.
Right? And that reward sits in your head. And then later on, as we'll probably discuss when we talk about stress, we stress eat.
Yes.
And we only stress eat the stuff that we want that instant reward from, which are all these things that we've been teaching our children.
Yeah. And that's what sugar does, because it goes and stimulates the same dopamine receptors in the brain That cocaine does. But you don't give your child cocaine.
Unless you
You
were in the
don't-
1800s, right? With Coca-Cola.
Well, I wasn't part of that generation, but but you don't tell your child, I'm going to give you, a drug if you're good at the doctor's
Correct.
clinic, but you don't think twice before saying that about sugar, which is why I say it's instant gratification and you're just setting the template for a bad life.
I read somewhere that if sugar was invented in this day and age, the FDA wouldn't pass it as an appropriate thing for food. It was quite an interesting...
I don't think that's going to happen in our generation.
Not going to happen.
Yeah.
But actually, lots of countries have started putting the statutory warning
That's right.
on food that contains sugar. So at least steps are taking place.